Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. So here's a question I want you to think about. What happens when a board-certified orthopedic surgeon steps away from the traditional system and decides to build a practice centered on movement, longevity, and passion? Today's guest, Dr. Adrienne Towsen of the Towsen Clinic, a shoulder and knee specialist, competitive ballroom dancer, which we're going to dig into that for sure, and a physician redefining what peak performance looks like at any age. Now, before we jump into this episode, just a quick message from our sponsor, Grow Solutions, where we believe brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the business side so you can focus on what you do best. Grow Solutions takes a diagnostic approach to your business. We analyze where time, money, leads, or opportunities may be leaking. So again, Grow Solutions is not an agency or vendor. We're your growth partner. So if you ever thought this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can be your solution. So if you're interested for a free growth consultation, just drop the word in grow below, or feel free to reach out to me on any platform. But you came here to meet our amazing guest today. Dr. Towsen, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Absolutely. Thank you so much for having me. And yes, I'm Adrienne Towsen. So I'm an orthopedic surgeon. I live in Westchester, Pennsylvania. So I've been in practice in this community, or had been in practice in this community in orthopedics for 21 years. The last 19 years, I was with a group that I absolutely loved, but I actually did just leave, and that was really entirely due to a private equity acquisition, and we can talk about that or not, but just became an unsustainable way to practice for me. So just about 9 months ago, I left and kind of pivoted. I was a sports medicine surgeon, shoulder and knee, and saw the need to really, saw the desire of my patients, to really remain active, all the way in through midlife and later in life. And then that was very much my goal, is keeping people active. I often called myself a lifestyle doctor as an orthopedic surgeon. And so now what my new passion and goal will be moving forward in medicine is to truly focus on that, and truly focus on being a little bit more proactive and preventive versus reactive, and helping people really have that same goal of maintaining, a healthy lifestyle, good movement, being able to, do all the activities they want to do for as long as possible. So, using the term Healthspan, I think, is a great term of really keeping people in through midlife and beyond, as healthy and optimized as possible, so that they can continue to do the things they want to do for as long as possible.
Yeah. Well, I'm excited for you. The whole health span, lifespan, which more important? I think enjoying your health through your entire life is the way to go. So I think that your community is is going to benefit from you opening your practice.
Thank you.
Absolutely, Dr. Towsen. I want to jump back to kind of the beginning. Was there a moment or a life circumstance that drove you into a career in medicine to begin?
So I think as a kid, actually, I was pretty interested in just, helping people and interested in medicine. My dad had wanted to go to med school and then didn't. He went in a different direction. So there might have been a little influence there, that I kind of always wanted to be a doctor. But then I would say, like, a turning point for me was probably I was an athlete through high school and college. And so I had an ACL injury. I played lacrosse and then went through ACL reconstruction surgery, and then really kind of went under the wing and was mentored by the surgeon who did my surgery. And so that was back when I was 19, many, many, many years ago in college. And, at that point, again, I already knew that I wanted to be a doctor, but I would say that's really what got me into the orthopedic world, and really made me, interested in pursuing a career in orthopedics, and then ultimately ended up in sports medicine too. So I think the athletic part of it, kind of helped that, and then really wanted to be able to do for others what, my surgeon had done for me. And, I was very fulfilled with, my career in sports medicine over the past 21 years.
Yeah. Well, your career is going to carry on, especially what
Yes.
you're doing now. I think it's
Yeah.
going to be great again for you. So
Mhm.
you went from working in a hospital, then into this large practice that you enjoyed, but some changes took place. Now you're opening the Towsen Clinic. And what's your overall take right now, kind of on the future of healthcare? And would you say we have a positive outlook to what's going on?
Yeah, that's a great question, and I think it's been interesting for me over the past year or so. Once I did leave my practice, and actually as I was like kind of gearing up to leave my practice, and really living day in and day out the corporate medicine influence that is really running rampant in our health system right now. So I think it's obviously a big problem still, and you can talk about insurance companies or big, large health systems or the private equity piece of it. So I think that more physicians, however, that I've kind of networked with over the past year or so, and others involved in healthcare in different ways are kind of fed up. Have really, I think there's a lot of people that have reached their breaking point. I mean, that's the best way I can describe it. When I finally decided to leave my practice, it was unsustainable for me for many reasons, and the values and the ideals of a corporate entity, especially a private equity company, does not align at all with the values of most physicians who are there to help people and not worry or not be totally concerned about the bottom line and the profits, which obviously is the corporate mindset. So I do see or sense a shift that a lot of physicians, and maybe it's just sort of my network people, because I've kind of really gotten involved with a lot of like-minded people in large
Mhm.
part through a lot of networking that I've done through LinkedIn. So it's been a great platform, to really kind of meet up with a lot of other like-minded people. And I see, a lot of, a big trend toward, physicians kind of, speaking out and doing things and forming groups and organizations and coalitions, to try to kind of, let's say, fight against, these corporate entities and try to, bring back physician independence. So I think there's a lot of effort going toward that now that I've really noticed more over the past like year or two. I think it's still a bit of an uphill battle, but I also do see, myself included, actually a lot of physicians kind of taking that, kind of leaving their corporate, corporately run, whether it's a health system or a private equity situation. I've just seen, it seems like every week I'm seeing another doc, going out and like starting their own independent practice. So it's been like fascinating to me to watch, because I feel like every time I turn around, somebody else is like announcing that they're opening something, small and private. So I do think there hopefully will be a shift, and there, continued shift toward promoting physician independence, the physician-patient relationship getting back to what it should be. Again, I think there's it's going to take some time still, but I really do feel like there's a big trend in that direction.
It's kind of the Roger Bannister effect, the 4 minute mile. Once
Yeah,
somebody, ran under 4 minutes, then, it was broken, I think, 6 times in the next
yeah,
month or something like that.
mhm,
When you show that you can go out into practice
right.
and survive, and more so thrive
Mhm.
and enjoy practice again. I know you said you enjoyed practice where
Yeah,
you're at,
yeah,
but it's the corporate structure that took away some of the joy from it, and you stepped away, and it's a big risk. What you're doing is a big risk, no matter what it is. And I don't think general population and patients understand the risk that's involved in that. But the pivot that you have taken in your practice is so unique in the fact that you're offering performance
mhm.
medicine and health optimization, which, as you said, you've done that in the past, but this is a unique approach. I'd love to get more of your insights on that, both peak performance and health optimization.
Yeah, for sure. So I think, again, coming from that sports medicine background, definitely used to treating people who, for the most part, I mean, it's not every patient that came through the door as an orthopedic surgeon, but, people that do want to, they're coming to me, of course, after an injury or perhaps with an overuse syndrome, maybe need surgery, although did a lot of non-operative care in orthopedics too, for people that had, overuse injuries, tendonitis, maybe just, arthritis, things like that, that we could treat in a non-operative way. Certainly there's always going to be a role for orthopedic surgery, because there are certain things that just need, if you break a bone or you tear a ligament or something, for the most part, there's things that won't fix themselves or won't be manageable without surgery. However, what we're also, seeing, and what I also saw, was that, there's definitely a role to get involved earlier than that. And, some of these things are, certainly preventable and manageable. But we just never had didn't have the time or the resources, to do that as an orthopedic surgeon. So if I take a step back and say, what else, can I do to help people that is aligned with what I used to do, and what I believe in? And it really is trying to keep people moving, healthy, and doing the things they want to do for as long as possible. And I think it kind of hit me because one reason maybe is we mentioned before, a competitive ballroom dancer. I'm 54 years old now, and I started that at age 46. So I'd been an athlete all my life, I played lacrosse, I was a runner and whatnot, but starting a new competitive sport kind of later in life, that requires, not only like physical endurance, there's the mental piece to it. There's a lot. It's actually a really great all around sport, but made me realize, how important it is to try to optimize your health, try to, I also have, kids. I expect to have grandkids one day, and all of these things that, we can pay better attention and listen to our bodies sooner. We can get the appropriate lab work done. We can take, if we can have the time to do it and take a step back and say, okay, what can I do to keep, these potential chronic problems from happening, or keep them, at bay, start sooner. I wish I would have started some things that I'm doing now sooner, in order to, stay fit, stay healthy, protect our cardiovascular health, protect our bone health, especially as women. There's so much that can be done that could then hopefully either prevent or lessen, some of the things I was then treating as an orthopedic surgeon. And then for people who do want to stay active in competitive sports and whatnot, I think there's a sort of a mindset that as you hit your 50s, 60s, and whatever, you're likely to kind of decline some, maybe put on some weight, maybe, have some more aches and pains, which, certainly can happen. But I think if you take a more aggressive approach at, trying to keep yourself healthy, there's a lot you can do to avoid that happening. You can certainly be still in great health and physical fitness well into your 50s and 60s. I see it in myself. I see it on the dance floor, with other competitors that are much older than me still, who look amazing out there. So yeah, so I want to be able to help people do that.
Yeah. I love it. So your specialties while in orthopedics were knee and shoulder,
Yes.
And you will still kind of do some of that. But what conditions do you expect to see of patients entering in your new clinic? Like what is it that you will be treating more often?
So, my goal is to really kind of offer services to that midlife person. That could still start, I don't know what you really want to consider midlife, if it's 40s, 50s, 60s, in those decades, maybe a little sooner perhaps. And certainly people who are even older than that too, depending on their situation. But, the goal is to, number one, what I'm so excited about is to actually just be able to have someone come in and talk to them for an hour, be able to have a full on comprehensive kind of evaluation, see what symptoms, if any, someone is having with regard to just how they feel. I think a lot of times what people are kind of saying, and what I've heard and what I felt myself, is I just don't feel like myself. And that might start in your 40s, it might be in your 50s. And it's, usually the foundation, the first thing to look at would be hormone levels. And so, certainly in women, perimenopause, menopause care. That's something. So I've been certified in, hormone replacement therapy or hormone therapy. So, but not only for women. I have a little bit of a passion for women's health just because of a lot of stuff that has gone on recently too, that there's been so much sort of misinformation over the years, so of trying to kind of clarify that and hopefully, reverse that and improve that a little bit, such that women, especially younger women in perimenopause, can get in and get treatment and get the care that they need, depending on what their symptoms are. But even looking at hormones is kind of the foundation. And for men as well, of course, the testosterone decline over time, that a lot of people may just be unaware of, or not getting the appropriate labs with their regular kind of lab draws that they might do with their PCP. So I think, the evaluation of any kind of, let's say, symptoms or just feelings of decline or feeling off or whatever it might be is step one. Getting to the, kind of the with the lab work and whatever, understanding, putting that together with the symptoms, because it's not always just the numbers. And I saw that in orthopedics too. It's not always just what the MRI shows. It's, you're putting that together with the patient's symptoms. And then starting with optimizing hormones. I've also gotten certified in peptide therapy. So And there's so many peptides out there, and there's a lot of controversy about that. But there's certainly, a large number, or even if you looked at maybe 8 or 10 peptides that are used, fairly regularly, those are things that could be added in. Again, depending on what people's goals are. I will
Right.
do, weight management GLP-1 work too, which I think, and there's a lot of benefit to those, peptides beyond the weight loss. So I think
Mhm.
that will be a part of it. And then I'm not really the expert. I'm not a nutritionist or like an exercise physiologist, but, lifestyle changes that could potentially be implemented with regard to nutrition, strength training, mobility. I would like to, at least get people kind of started in that way. And my hope is, as I expand the clinic a little bit, to bring in, actually have some people waiting in the wings in that regard too, for, a little bit more detailed work on nutrition and, strength training programs and things like that, because of
Mhm.
course that's a key piece as well. So
Yeah. Is in your studies of what you've done, and I know you mentioned about kind of uh, the lack of education, or kind of what we would say hiding, especially when it comes to female hormones, the black box removal of hormone replacement therapy. You mind sharing a little bit about that? Where someone would say, I've heard it wasn't good for me.
yeah,
That's You were lied to, in my
yeah.
opinion. You were lied.
Yeah, exactly. So I just, the book, there's a book that's been published and then revised called Estrogen Matters. I don't know if you've seen that or heard of that, but
No,
it
no.
basically is, breaking down all the trouble with the WHI study, which
Mhm.
basically was the Women's Health Initiative, in the late 90s, early 2000s, that was the reason, there was in 2002, it was that this big press release came out that said estrogen's bad, it causes breast cancer. And then that's when, prior to that, there was a little bit more hormone therapy done. And then since then, it's been a little bit difficult to backtrack. And, but that book looked at that study and really it refutes everything in it. So there was a lot of misinformation, there was a lot of misinterpreted data. Unfortunately, it's taken many years, to get to that point where, it's become kind of, again, public knowledge and whatever, that that's the case. And then with the black box warning just months ago, coming off of estrogen,
Mhm.
that's huge, of course. But unfortunately, I think it still leaves behind a bias that, for some anyway, providers and patients, or the public alike, that, hormone therapy is dangerous or not good because, again, specifically with estrogen in women, that it causes breast cancer, which is really not the case. And also, the protective and potential benefits of being on estrogen, particularly sooner as opposed to later, are huge with all of the
Yeah.
other systems in the body. As far as cardiovascular, certainly my passion also is, as far as bone and muscle health, because there's so much going on later in life with women, especially with osteoporosis and fragility fractures, that, could be essentially prevented, if estrogen is started soon enough. The huge estrogen declines that happen in menopause specifically, and even starting in perimenopause, is one of the biggest reasons that there's so many more fractures, especially hip fractures in women. So I think that, and the other thing that a lot of times people don't realize, or it's not, a statistic that people hear often, is that, cardiovascular disease is the number one killer in women, 7 times more than breast cancer, such that, and estrogen is protective in the cardiovascular sense. I
Mhm.
think, yeah. So I've really taken a deep dive into it. I've been able to be at a couple of conferences where, like, the absolute experts in the field, are speaking about it. And, really the consensus is almost any woman that's in perimenopause and certainly menopause should be on estrogen, with progesterone if she has a uterus, and, potentially testosterone too, depending on the labs and symptoms. So, and there's a very small, I mean, there's still some people where it could be contraindicated or you have to be careful. And there's, certain things you need to look at, but the vast majority, like 90% or more of women, would benefit from hormone therapy.
Mhm.
So, and there's much, I mean, I don't know the exact statistic, but nowhere near that of, women who are actually on therapy and actually being able to, like, get their docs to, prescribe it for them. So
Yeah.
yeah, so I think it's a huge need. I think, then there's a lot more kind of like education that needs to get out there to not only, the public and patients, but also to the docs that could potentially be providing that care.
Mhm.
So yeah.
Yeah. Yeah. Again, your community is so fortunate that you're coming back out,
Yeah.
in the right time to help people. You
Yeah.
had mentioned a little bit about of your knowledge with peptides. I'm going to throw
Yeah.
this one out.
Yeah.
You know, of what you studied, what's like your favorite peptide that you enjoyed studying about, or even, you know, applying with your patients?
Yeah. So, I mean, I haven't gotten a chance much yet to do. I mean, my own personal use would be, I did use a GLP-1 for a while. So I think that the GLP-1s are certainly an amazing, you know, class of medications, peptides that can be so helpful to people. The other one would be BPC 157 and TV 500. And again, that's really near and dear to my heart from the, you know, because it's really a musculoskeletal, you know, type anti-inflammatory and tissue regeneration and muscle, you know, recovery. So I think that they are wonderful. And those would be like, you know, two of the number one go-tos. I think GHK copper peptides, you know, also, again, a little bit more on my side of it as a 50-something woman, you know, as far as the help with skin and hair and things like that, you know, as far as also a little bit of like more longevity type, effects, you know, I think they're great. I think all of those are great.
Yeah. So we're going to get into your ballroom dancing in a bit
Oh,
here, but
sure.
you know,
Yeah.
and maybe we'll dive back into some of those peptide
Yeah.
components at that point in time. But I'd love for you to tell us, you know, you started your own practice. What's one thing, if there is a physician out there who says, you know what, I think I'm going to take the leap, what's one thing you'd like to share with that physician about making that leap?
I would say get a coach or someone that can help you unless you feel very confident on the like business side of it. So depending what your, you know, history was, if you were in a private practice that then evolved into something else, which is my situation, you may have a little bit more business knowledge. Although by the time I joined my private practice back in 2006, it was already an established practice. And so I had no experience starting anything from scratch. You know, and if someone's working more employed for, you know, a hospital or health system, you know, depending on, you know, the situation, they may or may not be very like business minded. So I would say if it interests you and you need to take a leap away from either a health system or some other corporate entity, do it, number one, because I think, you know, without a doubt, if that's your feeling, and, you know, in my situation, like I said, it had really become unsustainable. So I needed to make a change. But I would absolutely say, like, I have worked with a coach who's been, you know, instrumental in getting me to this point, and, you know, certainly getting me to this point faster than I would have on my own. I mean, maybe I could have figured things out eventually, but I think if there's, you know, as physicians, we most likely, you know, don't know all the ins and outs of some of the, you know, kind of background parts of running a practice, starting a practice. So I think it's important to, if you don't know the answers, find somebody who knows the answers, like find somebody who can help you, because I think you'll kind of spin your wheels for a while if you don't.
Yeah. Great advice. It's not, you go to medical school to learn to help
Yeah.
patients. They
Right.
don't typically say, okay, let's do business 101,
Right.
201, or 301. They don't go through that. So it's, and you've been in practice for quite a while.
Long time.
To take that leap and understand that it's, I'm opening it. And I think one of the best things about this, Dr. Towsen, is that the passion that you have for going back into practice, the way you're approaching this, I think is great. And that's only going to overflow into how you take care of your patients.
Yeah. Yeah, thanks. Yeah, I'm really excited about it. I mean, again, I loved my years in orthopedics. I always tried to do the best within the confines of like our, you know, scheduled templates and, you know, insurance, you know, issues and whatnot to, you know, offer the best care, educate people and do the right thing. But it was getting harder and harder to do with all the confines of, you know, the corporate entities and including the insurance companies too. I mean, it made it so difficult at times to be able to really care for patients the way that I knew I should or wanted to. So yeah, I'm excited about this.
Yeah. Well, by the time we release this, you will have opened your doors.
Yeah.
But from like, what's the focus that you're doing as you almost go to opening your doors? And again, when people are watching or listening to this, it'll be like, what's the focus of you and your business right now?
Yeah. So right now I'm kind of fine tuning the last bits of my EMR system. So I had an office, when I got my office space, it just needed to be renovated. So I got the office space back in October. It took about 2.5 months or so to do the renovation. It just kind of needed a major facelift. And so that was completed like mid-January. And so that was kind of, you know, one of the major steps, of course, to have a space completed. from the other end of it right now over this next week or two. It's really setting up schedules, going through the EMR, getting really familiar with every bit of it, because I'm used to using an EMR from the, let's say, provider side, and doing certain parts of it, but maybe not understanding all of it. And I've had some great training. The system that I chose, I think, is wonderful. And I've had some really great training with it, but I have like one more training session to do. It was just recently linked to the website. So I have to kind of, learn how that all works, that when people, click a little, like schedule a consultation and on the website, then it goes back to the EMR. So I need to be able to find where that goes and, all of that. So there's like little things like that like sound little, but they're actually huge, when trying to, because I'll be kind of a one-woman show for a bit. I have a team kind of waiting in the wings, some people that I will bring on and hire as soon as I can. But for the first, let's say, month or two, maybe, depending, it'll be just me kind of doing everything, which I think is good and bad. Like, it's a little bit overwhelming for me, but it's also good because then I will, certainly, I think, understand every part of it, how things, go, and hopefully try to develop, kind of that workflow that makes sense. So right now, I'm working primarily on like really getting a good solid grasp on like the EMR, and then how everything works on the back end of that with the website and whatnot. I have to get computers for the office. I mean, I'm just going to be like using my own laptop at first, which is fine. I mean, but I don't really need a ton more at first, but was just kind of looking into that earlier today, actually, like computers and, the printer scanners, all that kind of stuff. So it's otherwise all done with furniture and whatnot, but just a few more details to add. Yeah, so those are the last bits.
Exciting times, like a little kid in a candy store kind of. And see what's
Yeah.
going on. So I do want you to expound a little bit about your ballroom dancing. Now, it's not just, we're not talking about Tuesday nights going to a class. It's a true passion, and you're competitive right now. So I'd love for you to share that.
Yeah, I actually just got back from a competition last week. I was away so I'll back up just a little bit. So I started ballroom dancing in 2018 at the age of 46, and I had never danced before. And so it was just something, played other sports and, when I was younger in college and whatnot, but always a fan of watching it, like definitely watched Dancing with the Stars and went to a lot of the like live performances. I have two daughters who are 23 and 25 now. And so my daughter, and I'm single, I've been single since they were 1 and 3. So I raised them with my parents helped me, because it was certainly not easy as a single mom orthopedic surgeon. So, but my mom and my girls and I used to just be in love with the show. We watched, dancing, go to some of the live shows and whatnot. And so always really liked watching it. And then once my kids were like in high school, getting a little older, I realized, because I never got remarried or anything. So I was focused on my kids and my work. And then I thought they're going to go off to college and then beyond. So like, I'm going to kind of need something for me, or I would like something for me to kind of balance workout. And so then I decided to take dance lessons, more like you said, like just to learn, like maybe go once a week or something, like just to learn social dancing. I didn't know that you could do what I do, like the competitions, because the competitions that I do are pro-am. So my teacher is my partner. And there's a huge world for that. And I really had no idea until I went to the studio to take just, again, social dancing lessons. And then I was introduced to this, like, hey, like there were some other women at the studio who were very competitive and did this on a regular basis. And I was like, oh, that's really cool. And I went and watched a competition. And I was like, I think I want to do this, So then I started a program with my teacher, who I still dance with today, 8 years later, and started competing in 2018. So, and then it really it very quickly became a passion. So I take usually 3 lessons a week. And then, and so it's a long story too, because I have a long distance partnership with my teacher now, because he's from Italy. And so he was here working in a studio in the US when we met. And then that was 2018, 2019. And then when COVID came in 2020, he went home to Italy in March and then didn't come back. And I thought there was a chance he might not, regardless of COVID, just because he was here on a work visa for a specific period of time, and then didn't necessarily want to get a green card and stay here. He's close to his family in Italy, so it was kind of a temporary thing. However, we had a really nice partnership and connection, and so we decided we want to try to still dance together. So we've managed, and we do online lessons. So I take lessons with him now via Zoom 3 times a week, and then I travel to Italy about 4 times a year. And then we train more, kind of intensely in the studio where he is there for like 5 or 6 hours a day, again. And so like being able to do something like that, at my age is again,
Yeah.
something that I say, like, I want to continue to do that for years to come. So that means I have to, make sure I stay, optimized with, my
Mhm.
fitness and health and whatnot. So it's very important to me because this really has been, it's really a passion. So, and then we compete probably 4 or 5 times a year, usually out in Europe now, somewhere in Europe. So, but it's my whole, like, I have my work and my dance now pretty much, and
Yeah.
certainly my kids too, but they're out on their own. So,
Yeah.
but it's an amazing sport. I mean, there's a physical demand to it, of course. It's great for cardiovascular, for strength and flexibility too, and core strength and balance. There's a mental piece to it because we do 14 different dances, and so I need to know like choreography for all these dances, and there's a lot, there's a lot to think about all the time. So it very much, I mean, I think it's one of the most like kind of well-rounded like sports that there
Yeah.
is, really, and it's a lot of fun.
Yeah.
So yeah,
Good. I have seen videos of you dancing online on your LinkedIn, and it's
yeah,
fantastic. I mean,
yeah. Thank you.
you're not supposed to smile all the time. I can tell that from the dance, but you sure
Yeah,
look like you're having fun.
that depends on the day.
So
Yeah, there's certainly some, like, tango is a little bit like of a
there's some intensity to it for sure.
there certainly
Yeah.
is.
So, Dr. Towsen, you've been a great guest. I really appreciate it. If people are interested in learning more about you specifically in your
Yeah.
community and they would like to potentially come in and visit you,
Yes.
how would you like them to learn about you and how can they get a hold of you?
Yeah, absolutely. Well, we have a website for the new clinic now. So that's www.towsenclinic.com. So that's live now. And then my clinic is located right kind of in downtown Westchester, Pennsylvania. I'm on all the different social media platforms. So probably most active on LinkedIn. It's just my name, Adrienne Towsen, MD. I am on the other platforms, Facebook, Instagram, even TikTok with, again, by my name, you can find it. And I have done some, content for the clinic as well on those other platforms, but LinkedIn is where I am kind of the most. And the clinic website would be great too.
Okay. I'll make sure that we share all of those links on
Thanks.
there for you. Absolutely. Two last questions here. As a health and wellness professional that you're going into, could you give us one piece of advice that would affect us all in a positive, healthy way?
Yeah, I would say, I think the best thing to do is pay attention to your overall movement and nutrition, honestly. I mean, I think the one thing that I saw really with my orthopedic patients and plan to see moving forward is, you don't want to get sedentary. That doesn't mean you have to be out, playing an organized sport, but I think, movement is key. So even if it's just walking or, doing some other form of light exercise, like, don't let yourself be sedentary, because even with an arthritic joint or some kind of, maybe other overuse issue, it's usually better to keep moving. And I think, once again, that is married very closely to nutritional, things, and trying to have the appropriate protein intake and other things to build muscle, because I think muscle is so key. And that's also, as we age, our muscle will decline some. So I think trying to make sure that you don't let that happen is key. So,
Yeah. I know this is piggybacking on it a little bit, but since you're a great guest here on the Prime Health podcast, what would your personal definition of Prime Health be?
Yeah, I think, I'm going to say I'm going to talk about it as a midlife woman. And I would say that I think it is trying to maintain something in your life that brings you joy and that gives you that's a passion. So I think what like motivates me, to stay healthy and do the things I want to do is dancing. So, and certainly it's not going to be dancing for everybody, but I would say that finding something that gives you some sort of joy and like motivation to like keep going is how you stay healthy, especially as you get into midlife and beyond. I just think that's so critical.
Yeah, I think that's great advice, regardless if you're a middle-aged woman or not.
True.
It's something
Yeah.
that you could use for a man, even younger it is. So I appreciate that.
Mm-hmm.
Dr. Towsen, I really appreciate your time here on the podcast. You've got such a unique perspective, especially kind of starting the same second career over again. Going from orthopedic surgery, working where you were, loving what you did, and saying, I need to take time for myself and step away because it's not healthy for me, I guess you could say, is what you're saying. But now, middle-aged, have the passion for dancing, but restarting your practice. I think is fantastic. You took the leap as you dance and swing through, but you take the leap in practice. And I think that that's really, really amazing. And most won't do that.
Right.
So I commend you for that.
Oh, thank you.
Selfishly, I'll always tell people to subscribe to the Prime Health Podcast. We're always looking for more guests and subscribers on it. But until next time, remember that true wellness is a journey we are all on together. Now, whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. And again, Dr. Towsen, thank you so very much for being a great guest on the Prime Health Podcast.
Oh, it's my pleasure. Thanks for having me on.